Hey everybody, wanted to talk to you about all the different types of neuromodulators, which is just a fancy term for the Botoxes of the world. There's a lot of competitors out there now, so I wanted to kind of go through, talk to you about the differences, and so you know which one's the right one for you, and if there really are any significant differences. So there's Botox, that's the grandmother of them all. It's been around for a couple decades. So it's Botox, then there's Dysport, then Xeomin, and now there's a new one called Jeuveau from a company named Evolus. You might see a lot of hashtags for that, new tox. Well, that's for Jeuveau. So Botox, Dysport, Xeomin, Jeuveau. What these are all used for, just to kind of a nice review, that Botox and all of these, they're all basically come in a powder in a bottle. All right, this is an example of Xeomin. It's just a powder that comes in a bottle, and then you reconstitute that by putting in some saline, make it into a liquid, and you take that, and it's like the consistency of water, so it doesn't really hurt going in. It's a really small needle, and you can inject that into the 11s, forehead, around the eyes, even help with a gummy smile, inject into the jawline to narrow the jawline, or help with TMJ or grinding of the teeth. Anyway, you inject those, and the idea, they don't exactly know how these work after all these years, but the pretty good idea is that these injections, they go in, they block the receptors that are acted on by acetylcholine. Now, what acetylcholine is that basically if your nerves are wanting to stimulate a muscle, the nerves release acetylcholine, they bind to a receptor, they stimulate that muscle, the muscles react, and then that's what causes wrinkles in the forehead and all those areas. So with Botox and all their competitors, they somehow block those receptors so the acetylcholine doesn't act on those muscles and those muscles don't react, and then therefore you don't have those wrinkles. Anyway, so with Botox and all these competitors, they really all do about the same thing, and they all have the same effect. I know that you'll talk to different doctors or different drug reps and things like that, and they'll say that Botox is better than Dysport, or Dysport works faster than Xeomin. It's really kind of hard to know, and the thing that's really telling about whether they're better or not is when these competitors come out with their own product, they don't do a study to show they're better than Botox. They actually come out with what's called a non-inferiority study, and all that means is they're showing that they're not inferior to Botox. They're basically saying we're not better, we're not worse, we work just as well as Botox. And think about how odd that is. A car company would never come out and say, you know what, we're no better than Ford, we're no better, we're no worse, we're just the same as a Ford. And that's essentially what all these companies are doing, is they're showing that they're really the same as Botox, no better, no worse. So which one should you use? Well, I'll tell you that Botox, it comes with this active ingredient, the botulinum toxin, and then around that is an inactive protein. It just does nothing. Why it's like that? That's just a proprietary issue with the company that creates Botox. And that extra protein that does nothing, what I found that it makes the product more unstable. Why do I say that? Because when they ship Botox, and in fact when they ship Dysport and when they ship Xeomin to the doctor's office, they have to ship it in styrofoam and dry ice to keep the proteins from denaturing. With Xeomin, and when they ship it, it just comes like in a regular box. Now, after you put the saline in to reconstitute it, you do have to put all of them back in the refrigerator to keep them nice and cold. But as far as shipping the product to the doctor's office, Botox, Dysport, and Jeuveau, they all have to be put in a styrofoam box with dry ice. And I don't know if that's like bad for the environment, but I'm guessing having a bunch of styrofoam being produced is probably not great for the environment. So that's the reason I use Xeomin, is not because I'm so worried about the environment, of course I am to some extent, but the reason I like Xeomin that doesn't have to be shipped in that styrofoam and dry ice is because if it is like on my shelf, because I don't have to refrigerate it before reconstituting it, and there's a power outage, then I don't have to worry about all of it going bad, because all these other products that I mentioned, before you reconstitute them, they have to stay in the fridge, they have to stay cold, and if there's a power outage, which does happened a lot when I was living in Louisiana, still happens a little bit here in San Francisco, that when there's a power outage, you have to worry about those products going bad. With Xeomin sitting on the shelf, I don't have to worry about that, but the other products I do have to worry about that. So that's why I'm kind of more on the side of Xeomin. Now, since I chose to start using Xeomin, and I use a lot of it, I have since becoming a paid consultant to the company that makes Xeomin, so in full transparency, but I can tell you with all honesty that I was already using Xeomin before I was a paid consultant, and it was really because I liked the fact that it was more stable and I didn't have to worry about power outages, because there were definitely many a weekend when I was living in Louisiana and a hurricane would hit, and I'd have to go into the hospital and put all of the Botox. I'd have to take all the Botox that was already in the fridge because there was a power outage. I had to move it all to a refrigerator that was connected to emergency power. So after you do that a few times, you realize, like, you know what? let's find a more stable product to use. And so with Xeomin, it is a pure toxin. They don't have that extra protein around it. So if you can say that a pure toxin is a good thing, still a toxin, then that's a good thing about a Xeomin. You don't have to worry about that extra protein, and from a doctor's perspective, I don't have to worry about it going bad if the electricity goes out. Anyway, so those are the different products. They, in my opinion, all work the same. They all start acting as fast as one another. You know, they all start to work in 1 to 3 days. They all hit their maximum effect at 7 days. They all last anywhere from 3 to 6 months. Different people will have different opinions. They're not really all part of a clinical study. People will just have anecdotal evidence to say that maybe they feel like Dysport works faster than the other products. I really don't feel like there's any difference between all 4 of these products, but I personally use Xeomin for the reasons I stated. When it comes to cost, they really are all about the same. You know, the doctor will charge anywhere from, like, you know, maybe if they're having a special, they'll charge $10 a unit if it's like a really good special. But usually I feel like between Louisiana, California, it's anywhere from $12 to $16 per unit. Some doctors will charge based on the area. They won't say a specific unit cost per unit, but they'll say, you know, oh, we charge this much for the forehead and in between the eyebrows, or this much for the crow's feet. So it'll change a little bit based on the doctor, but I want to give you a little bit of insight, is that Botox, Dysport, Xeomin, Jeuveau, it's generally the same cost. What you will see that's a little bit disingenuous, I don't know why doctors or med spas still do this, but when it comes to Dysport, you'll notice that it's always listed as less per unit. Like, for example, you can see Botox is $15 per unit, but Dysport is $5 per unit. The thing you have to know about that is that you have to use 3 times as much Dysport to get the same effect as Botox, Xeomin, or Jeuveau. So if it's $5 per unit and you have to use 3 times as much, that's $15 per unit, no difference than Botox, as an example. So just kind of be a little bit more aware of that if you see that Dysport is way less expensive, it's really not going to ultimately be less expensive, because it's going to take 3 times as much to get the appropriate dose. So keep that in mind. But if you are looking at pricing, you can check buildmybod.com, find a doctor near you, and see how much they charge for these different treatments for those different areas stated. So if you have any questions about all that, let us know. If you're watching us on YouTube, please subscribe to our channel. And if you have any other questions, please email them to us, comment below, and we will make a video about that as well. Thanks so much for watching.